Yeah, thank you. I will pause on the first slide here. Thank you, Dr. Peterson, for showing the image earlier, but just to get a size and scale from our robot there, it's brought into the operating room in a surgical tray and is quite easily handheld. So I always talk about surgery in a shoebox kind of scale. So I don't like that internet picture. Somehow we have to expunge that from our lexicon. That's too big a robot to dedicate for this. But I want to tell you a little bit about an experiment we've done recently on the space station. It was a technology demonstration where we flew that device, and it's actually still up there. It'll come down towards the end of this month, but it's still on the space station right now. I'm Chief Technology Officer of Virtual Incision, and I'm also a professor at the University of Nebraska. But I've done NASA stuff all my life. I started out doing Mars rovers, working at JPL and some places like that. And then we've been on the NEMO missions. We've been on the zero-G flights. We've done some telesurgery between Johnson Space Center and Nebraska. And now we'll tell you a little bit about what we just did on the space station. The MIRA device itself was recently approved by the FDA or received market authorization just about 6 weeks ago. I'll point to the picture again, just again to give everyone an idea of scale. The device is used just like that. There's no draping involved or anything like that. It's sterile as is and can be re-sterilized like that. So it's kind of a different approach to surgery. You can see the two arms and the camera that are actually inserted physically into the body, and that also changes that dynamic. That, again, the picture we've been talking about with the big robot has to be mounted to a rigid floor relative to the patient to get good motion. We kind of take that rigidity for granted on Earth, but this is kind of self-registered, which is nice. So we have a console and then a robot and camera, which again is quite small, and then we have a little support cart where you set up the device and use it like that. This is sort of Earth MIRA, but we dubbed what we called Space MIRA for this mission. We had to make the device a little bit shorter. You can see that long section in the middle there. That's for different body types and abdominal wall thicknesses and allows you to put your incision where you like and have surgical target in different locations. But we had to shorten that up a little bit because we flew on a express rack locker, which we just had to fit inside of. There it is in the tray. Again, it's quite small and easy to carry. I guess mass power volume, the robot itself weighs about 2 pounds. Power is less than 10 watts. Volume is, well, smaller than that because my arm's sized. And I would add, we did this experiment with about 400K bandwidth up and down. Of course, the video down is really the dominant part of our communication. So not too intensive either. This is our experimental design. On the left is the front of the express rack locker, and part of our mission, we really wanted to minimize crew input. So connections to power and Ethernet, and then basically the power switch. There was one sort of selector at the top there where we went between our first experiment where the robot operated by itself, and then our second experiment where the robot was controlled by 6 surgeons on Earth. You can see the device inside the box there on the right. On the far side is what we called, I keep sticking to simulated surgical tissue, but it was rubber bands. Rubber bands were nice because they're captive. You can cut them and you don't want things floating around, so rubber bands worked well. Lots of pre-flight testing, but unfortunately much of it overlapped with the FDA testing. We show vibration here because that's a key one. Very happy that our device is robust enough to survive a launch into space. And there it is inside the locker. There's some power supplies and some Ethernet switches and things like that, support equipment involved. But again, operating room in a shoebox. There we are going up on the Cygnus capsule on a Falcon 9 rocket. And I just got to play rocket videos, right? If you have a rocket video, you have to play it. We got to go down and see the launch, and when that first stage comes back, it's as impressive as you might imagine. It's pretty spectacular. So I'll flip by there. There's the Cygnus craft docking with the space station. Astronaut Laurel O'Hara is installing our rack. It comes out of the capsule and then is placed inside the rack. And really, there's not much other interaction. Again, you can see the red and yellow buttons where they'll connect power and Ethernet, but that's really about it. We had her open the box and check a few connections just to verify them, but all was well, which is spectacular. So you open the box and you can have access to the device inside. So I mentioned the two experiments. This is actually an autonomous mode. This is pre-programmed. So we had a pre-programmed path for the robot to follow. We just heard in the last presentation it can be difficult to establish communication, so we kind of wanted to burden the hand, and we were going to cut some rubber bands on flight. But you can see a left-hand grasper, a right-hand pair of scissors. You can grab the rubber bands and apply tension. This is in zero gravity, so you can see the rubber bands kind of float around a little bit, and the internal stresses kind of drive where they go. But this was the simple experiment. As soon as the device was turned on, the robot executed that. But the big part of our work was the telesurgery, where we had, again, 6 independent surgeons operate the device from Lincoln, Nebraska. We communicated through what's called the HOSC, which is a facility at Marshall Space Flight Center, and then to White Sands, and then up to the TEDRA satellites, and then to the space station. Of course, we operated for a couple of hours. That meant the space station is all the way around the Earth, so it's, at some points it's 8,000 miles away. That's about as remote, I think, as we're going to get in surgery for some time. Not forever, but for some time. We created our own mission control. In the foreground, you can see the 6 surgeons lined up there waiting for their moment. And then we had a row of engineers in there monitoring things and making sure things were going smoothly. Top left is the image from the space station. That's live from the space station. And then we had loss of signal and some other things, information from the space station displayed there as well. But again, far left, you can see the surgeon sitting at the console executing the tasks, driving the robot from Earth. There are our 6 surgeons. You'll see many of them around this week. Happy to do introductions. But we think this is the world's first, that we teleoperated a surgical device from such a distance and in space. So it was quite exciting, frankly. I have a little video here. Not because they are easy, but because they're hard. Okay, goodbye. It looks like she's already got the locker inside the locker location. Already working on the policy. Robotic surgery, can you see the video? Robotic surgery here. We're paper ready for you to enable the paper.
Well, that was a surgery out of this world, right? So huge leap for surgical history.
This will change the way the surgery can be done on planet Earth, not only in space. It's a great day for medicine. It's a great day for robotics.
Robotic surgery here. Congratulations to you guys.
One small rubber band. What else you doing for surgery? Thank you.
Maybe a little overdramatic with Kennedy and Armstrong, but we really mean this. Surgery at any location, be invariant of the patient location and the surgeon location is a good goal going forward. Just some real preliminary results, which I think are interesting, and again, this is preliminary, But there was about 600 to 800 milliseconds of latency during the experiment, which were just related to NASA comms and some time of flight in there, but mostly NASA comms issues. If you do, had a surgeon do the same task on Earth, which you see on the left. You can see that they moved a lot. There's some numbers up there, which I'll just kind of point out. To do this task took them 4 minutes and 46 seconds, and their left hand traveled 2.02 meters, and their right hand traveled 1.73. So they did it quickly, but their left hand moved a lot compared to their right hand. When we simulated latency on Earth, you get the middle plot, and then the actual space station experiment was on the right. So they were very careful. So the question is, what does this latency do to you? They were all able to complete the task, so that's the first thing, the successful completion of the task. But the time doubled, but they traveled much less. They were more precise, I believe, in their motions, which is kind of interesting. Probably because they were nervous about breaking something and having it floating around the space station. But again, it's preliminary results. We don't have all the data yet until our experiment returns at the end of the month, but I think there's going to be some exciting stuff to say about telesurgery from this experiment. One of the things we're very excited about, though, is actually telesurgery on Earth. We've always been sponsored by NASA and the Army in my research because they both want to do surgery in crazy places, right? And we've done a lot of telesurgery over the last year or two. And you can see one of the advantages of our system is everything you need for a surgery is on your left there. Inside those blue, there's a robot, there's a camera, and what we call a support arm to hold the device. Your instruments are there as well. And your forward environment needs something that's very simple, very small, very efficient. You don't want to have extra electrical and door requirements. You may as well bring a surgeon at some point. So I think that's a big advantage of our system is just the simplicity and size. And then, of course, the console will be at the remote location with the surgeon. We've done several animal surgeries over the past year from remote locations, and we're going to do more this year. We're planning a Chicago to Lincoln here very soon. Just as a side note, there's an International Museum of Surgical Science in Chicago. You guys all knew this, but I'm an engineer, so I didn't know this probably until recently. But they have a traveling health in space exhibit coming May 30th to the end of the year. And we're going to have our ground test unit on display there. So if you want to find out more, you can visit there. But we think miniature is the way to go for telesurgery. So thank you very much.